Arthritis is the most common cause of disability in the United States. Joint pain can lead to stiffness, weakness, loss of function, and an inability to perform desired or necessary activities. Sometimes we can help manage these conditions and the pain they cause non-surgically with multiple different conservative options. When these options fail, we talk about joint replacement surgery. There are more than 700,000 knee replacements and more than 400,000 hip replacements performed in the United States each year. More than 4.5 million Americans are currently living with an artificial joint. More than 90% of patients that undergo a joint replacement surgery report a significant reduction in their pain, improvement in function, and improvement in quality of life. I provide hip and knee replacements to appropriate patients when all other measures have failed to improve their symptoms. There are multiple different options for knee replacements that I can provide using various technologies customized to each individual patient. I also offer different techniques of implantation, including cemented or glued-on components and press-fit components that allow incorporation into the bone biologically. When it comes to hip replacements, I offer 3 different anatomic approaches to accomplish this. Each of these approaches exploit different anatomy and therefore have different risks and benefits. I offer the direct anterior or minimally invasive, posterior, or anterolateral approach depending on the individual patient's preference, anatomy, or pathology present at the time of surgery. Additionally, I provide revision surgery when an artificial joint is compromised structurally or functionally. I can climb the ladder in complexity as needed and can even replace an entire femur with an artificial hip at the top and artificial knee at the bottom. This way, if a complication arises with a joint replacement at any time, I can be a one-stop shop for my patients from a continuity of care standpoint and prevent patients having to travel or visit multiple surgeons to have their condition managed.